If you spend any time looking for natural ways to ease joint pain, you've probably seen videos claiming 1 teaspoon of this oil or 1 spoonful of that seed will basically cure your arthritis overnight. I wanted to know, is any of that actually true? So I went through what the research actually says, and the answers surprised me. Some foods really do help, most of the viral ones don't. By the end of this video, you'll know exactly which three are backed by real evidence and which two everyone's wasting money on. Quick context: joint pain in people over 60 is usually driven by one of two things: osteoarthritis, which is wear and tear on the cartilage, or inflammation, which is your body's immune response flaring up around the joint. Diet doesn't reverse cartilage damage, nothing does, despite what some thumbnails promise, but diet can meaningfully reduce inflammation, and less inflammation usually means less pain and better mobility. That's the real mechanism, and it's the difference between marketing and medicine. First up, fatty fish: salmon, mackerel, sardines, anchovies. These are rich in omega 3 fatty acids, specifically EPA and DHA. Multiple clinical studies, including research published in peer reviewed rheumatology journals, have shown that omega 3 intake can reduce joint stiffness and tenderness in people with rheumatoid arthritis, and there's reasonable evidence it helps with general inflammatory joint pain too. How much? Most research uses doses equivalent to about 2 servings of fatty fish per week, or a fish oil supplement in the 1 to 3 gram range of combined EPA slash DHA. Though if you're on blood thinners, talk to your doctor first, since omega 3s can have a mild blood thinning effect. This isn't an overnight fix. The studies that show benefit typically tracked people over 12 weeks or more. So if you start eating more salmon, give it time and treat it as one piece of a broader approach, not a cure. Second, extra virgin olive oil, and the extra virgin part matters here. Olive oil contains a compound called Oleocanthal, which actually has a similar mechanism of action to ibuprofen. It inhibits some of the same inflammatory pathways. That's not an internet rumor. It's been documented in actual pharmacology research going back almost 20 years. The catch: refined or light olive oils lose most of this compound during processing. You want cold pressed extra virgin, and realistically, you're getting a mild anti inflammatory effect from regular dietary use over time, not a single dramatic spoonful before bed. Think of it as one part of a Mediterranean style eating pattern, which is the diet most consistently linked to lower inflammation markers in research. Third, leafy greens, spinach, kale, and cruciferous vegetables like broccoli and Brussels sprouts. These are high in antioxidants and vitamin K, and cruciferous vegetables specifically contain a compound called sulforaphane, which lab studies have shown can block enzymes that cause joint inflammation and cartilage breakdown. Most of this research so far is in cell and animal studies rather than large human trials, so it's promising, but not as definitively proven as the omega 3 research. I want to be honest about that distinction. Practically, though, leafy greens and cruciferous vegetables are linked to lower levels of CRP, a blood marker doctors use to measure inflammation in the body. So, even with the caveat, there's real reason to eat more of them. Now, here's the part most channels skip because it doesn't get clicks: the viral miracle foods. Number one, random seeds claim to open leg veins or fix circulation overnight. There's no clinical evidence that any single seed changes blood vessel function in hours. Circulation issues in seniors are usually related to things like peripheral artery disease, which needs actual medical evaluation, not a teaspoon of seeds. Number two, the 10,000 times better than eggs protein claims. This usually misrepresents a lab measurement out of context, comparing a tiny serving size or a totally different nutrient against eggs in a misleading way. Eggs are actually one of the most complete, well studied protein sources available, especially for older adults trying to maintain muscle mass. If a thumbnail says a vegetable beats eggs by 10,000 times, that's not a real verifiable number. It's marketing. So, practically, here's what I'd actually do: aim for fatty fish twice a week, cook with extra virgin olive oil instead of more processed oils, and add a serving of leafy greens or cruciferous vegetables most days. None of this replaces medical treatment if you have arthritis or chronic joint pain. These are supportive habits, not cures. If your joint pain is sudden, severe, or comes with swelling, redness, or fever, that needs medical attention, not diet changes. If you found this useful, the next video I'm planning covers the exercise side of joint health, specifically which movements actually help and which ones to avoid. Subscribe if you want that when it goes up, and drop a comment if there's a specific food claim you've seen online that you want me to actually check the research on. See you in the next one.